Hello, my name is Gabrielle Crenshaw. Today I'll be doing the injection site video. Okay, for the first one, I'll be doing the Deltoid, which is the IM or intramuscular injection. So for this one, it can be injected at a 90-degree angle, and it's best seen when a patient holds their arm up. And for this one, it's one of the smallest injections, so only small aqueous solutions can be injected at this site. So we're gonna go down to about halfway of the arm where the humerus meets the deltoid, and you don't wanna go below this midline point, and you don't wanna go above where the atrium process is at. I'm gonna put 3 fingers right here, 1, 2, 3, and then I'm gonna make a V shape. And this is where I'm going to insert at a 90-degree angle. Okay, so the next one I'm going to do is I'm going to do the dorsolateral aspect of the upper arm. Okay, so where that midline is at, we don't want to go above that midline, and we don't want to go below where my 3 fingers is at, which is at the elbow or the aquilium process. So this is going to make a rectangle shape. Okay, and dependent upon the size of the tissue and the length of the needle, it will be given at a 90-degree angle or a 45-degree angle, because this is a subcutaneous injection. Okay, so for the next one, I'm going to do the forearm, which is an intradermal injection. So I'm going to go 4 fingers at the wrist, and I'm going to go 4 fingers at the intercubital cluster, and this is going to make a rectangle shape too. And for this one, I'll be giving it at a 15-degree angle or less. And I'm going to make sure, I'm going to watch out for any blood vessels or any tendons, and then I'm going to inject at that 15-degree angle just below, just underneath the dermis until I see a bubble. Okay, so the next one I'm going to see y'all on your back. Okay, and for this one, it's going to be at the abdomen. Okay, so I'm going to go 2 inches just around the umbilicus, and you don't want to go below that pubic line. You don't want to go above that costal margin. You don't want to go out of that anterior and posterior iliac spine. So for this one, it's a subacute injection, which means that it can be given at a 45 or a 90-degree angle, depending on the size of the tissue and the length of the needle. And this injection is good for multiple injections, just like insulin and just like heparin. And it should be able to do fingerprint intervals, which is like 1, 2, 3, 1, 2, 3, 1, 2, 3, and it will be making a U shape. So depending upon that size of the tissue or the length of the needle, I'll be giving it at a 90-degree angle or a 45-degree angle. Okay, so the next one, I'm gonna get my patient to lay on her side, facing me. Okay. So for this one is the preferred site, which is the ventrogluteal site. So this is best seen. This is best seen when a patient bends their leg. Okay. So you want to come around this side and put your leg down. So I'm going to put my arm just like this. I'm going to have my thumb at the groin. I'm going to have my index finger at that anterior and posterior iliac spine. And I'm going to have my pointer finger at the iliac crest. And that's going to make a V shape. And I'm going to palpate for any bony areas. And once I find my good area, I'm going to take a alcohol wipe, and I'm gonna wipe around the area, leaving the alcohol right there, and I'm gonna switch my hand, and I'm going to insert the needle at a 90-degree angle, because this is a IM intramuscular injection. Okay. So for the last one, I'm going to do the vectus lataris, which is the thigh. You can still stand like that. Okay, which is going to be the thigh. So again, this side is best seen at the when you bend the patient's leg. Okay, so you want to make sure that it's a hand script from that greater trochanter and a hand script from that knee. Okay, and it's going to create a long V shape, and you want to insert probably about 1/3 of that rectangle shape, and you're going to insert at a 90-degree angle. Okay, and because this can be injected at the interior thigh, it can be given at a subcutaneous injection as well. So you're going to go a hand script from that greater trochanter and a hand script from that knee. And we're going to go at a rectangle shape, and you can inject about 1/3 of that thigh, and we're going to inject at a 90-degree or 45-degree, depending on the size of the tissue and the length of the needle. Okay.